Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, I'm Dr. Nitin lovhale. I'm a consultant neurologist practicing at Mastish Neurocare Center, Borivali and Vasai. So I'm a kind of a freelancer and I have my clinics at Borivali and Vasai where I cater to this population.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay, so your brain is the most important part of your body. Okay, it controls all your hands and legs movements or anything what you want to do. The brain is composed of a lot of wires. Like if you just imagine a electric pole with a lot of wires in it. So similarly, it's all consist of a circuit. So seizure is basically a short circuit which occurs in a brain. There's a short circuit in the electrical grid, and that's why you get a seizure. So because of a short circuit in the brain, you start having a hands and legs starting involuntary movements. Your face becomes abnormal, and you may lose consciousness. So it's basically a short circuit in the brain.
What is epilepsy?
Epilepsy is nothing but it's collection of seizures. When one or two seizures occurs, then you know it's known as a epilepsy. So it's a condition where it occurs. You have more than one or two seizures, and seizures should not have any known reason like fever, infection. So it should be kind of a unprovoked seizure. Okay, and some people may have unprovoked seizure, or some patients may have provoked seizures, and which might overlap with each other. So even those who have epilepsy, there might be some triggers also which might cause them again to have a seizure.
What are the different types of seizures and do they affect people differently?
Yeah. So seizures have been divided into two groups known as generalized or focal, depending on which part of the brain is activated. So if the whole of the brain, the electrical short circuiting occurs, you get a bigger seizure known as generalized seizure, where a patient falls unconscious. And suppose a small part of the brain, there's a short circuiting going on. So you might have only one side of the body moving, some facial twitching, which is known as a focal seizures. Though patient may have any one type, but sometimes this might overlap. A focal seizure patient may get a generalized seizure, or even a generalized seizure might have just a focal seizure depending on his activity located. So they can interchange and they can overlap also.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
So 40% of the people, there is some cause which you can find. Around 60% of the people, you may not find any cause. And this patients we know as idiopathic or not no undetermined cause. So in 40% of the people, you might have some causes like during birth, they might suffer brain injuries in a form of low oxygen, known as hypoxia, or low sugar, known as hypoglycemia. As they are growing up, they might have brain infections or some brain malformation. The brain has not developed very well. Some people may have tumors, or some as they grow older, in older age, when they get seizure, it's most of the time because of stroke. Sometimes genetics also play a very important role. Those who have a genetic predisposition, so they are more prone to get seizures as compared to those who do not have. So in certain conditions, they might precipitate seizures.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Okay, so signs and symptoms of epilepsy are depending on what type of epilepsy occurs. The most common, what you have seen, even when you go to a market or even in your household, what you must have seen is a patient makes a loud noise. There's a loud noise. He cries, and then he dhadak say falls on the ground with a lot of jerks to the hands and legs, face twisted to one side, frothing at the mouth. Sometimes he has passed urine or stools in the clothes, and then which lasts for around 30 seconds to 1 minute, and the patient becomes unconscious. After some time, he is around 2 3 minutes, he gains his consciousness back. So this is what we have seen. Okay, this is what you must have witnessed on the roads or sometimes while traveling. This is known as a generalized epilepsy. And some patients, you might not notice, they're very subtle. So they might just have some facial twitching, or they might have just eye twitching, or they might just turn their head like this to one direction, or they might just look at one point and keep on blinking their eyes, or they might involve only one hand jerking movements like this, like this, like this. So that is known as focal epilepsy. So depending on which part of the brain the seizure originates, you might have different symptoms. Some patient may vomit during those times. Some patient may do some abnormal, bizarre thing which you might not be able to pick it up. But this all part fall sometimes into focal epilepsy.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Okay, so so unfortunately, na, the epilepsy was not known earlier. Historically, it was not known earlier. So most of the people will think that it was a, someone had, it's about a ghost, bhoot pret ki baat hai, and all the stuff. So they would involve in a lot of other activities rather than going to a doctor. So it's a very frightening disease. So whenever someone sees that, people usually get scared. So that's why they usually tend to avoid talking to such people. So it's basically a social stigma.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Okay, so the triggers usually the most important things are triggers. Triggers are what? Triggers are something which precipitate epilepsy. So you need to take care of these triggers. So what are those triggers? First is sleep, insufficient sleep, not taking medicines on time, fever, infections. They all precipitate seizure. In females during the menses, sometimes those provoke seizures. Flashes of lights. Even if when you're traveling in a train, and suppose a person who is getting who has epilepsy, and he's traveling in a train, and there's this rays of sun rays, they are like blinking. Even that might trigger seizures in him. So there are multiple factors, and this needs to be taken care of.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Yeah. So, how do we prevent, or what are the lifestyle modification you need to do is you need to prevent these triggers. The foremost thing to prevent this trigger is to have a good sleep. A 7 hours of a sleep is a must in a patient with epilepsy to prevent further seizures. Similarly, taking medicines on time. Whatever the medicines are given, see to it you take it on time. Do not miss it, not even by half an hour. Even if you're fasting, see to it that you take the medicines on time. Engage in physical activities like yoga, sports. Do not go in for vigorous sports or high risk sports or heavyweight gymming or something unless until you consult with your doctor. Do not drive. Keep away from swimming pools unless until your doctor gives the permission. Do not go on heighted areas alone, and do not go near fire wherever there are bonfires and all the stuff. Avoid going to these places. Try to keep a relaxed mind so that you do not precipitate these seizures. Try to keep your stress to a minimal level, as stress is one of the important factors to precipitate seizures.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Okay. First of more than the safety tips, these are safety tips for the caregivers. Okay, the caregivers or the relatives should know how to take care of a patient with epilepsy. So what happens is once a patient gets a seizure, everyone gets scared and everyone starts running here and there to get help rather than focusing on the patient. So the foremost thing, what you need to do is be there with the patient. Whenever he's getting a seizure, support him, make him sleep on the ground, put him in a left lateral position, turn him onto a left lateral position. Do not put your finger, your spoon, keychain into his mouth. Do not try to forcefully open the mouth, as this might cause injury to him and to yourself. If you have a handkerchief or maybe a small dupatta which can be rolled and put in between the two teeth so that he can prevent a tongue bite, that is most helpful. There's a myth that you apply shoe, sandal, or an onion so that he gets up. Do not do all this stuff. Just be there with him, put him in a left lateral position, secure his teeth so that he prevents a tongue bite, and just wait. Normally, a seizure lasts for around 20 to 30 seconds, after which it will stop and he will become unconscious. After some time, he will get up. Do not forcefully put water in his mouth, as he won't be able to swallow and you might choke him to death. So wait for him to get up. Wait for him to regain his consciousness. Once he regains his consciousness, give him that extra dose of your medicine and ask him, has he forgotten to take in the medicine? Has he taken his medicines or not? Okay. Suppose he gets a one seizure, don't worry. Okay. But suppose if in a line he gets a multiple episodes, the seizures are not stopping, immediately call in for a helpline and take him to the nearest hospital. Apart from that, see to it that your household surroundings are taken care of. See to it that the sharp objects, whenever you have such patients in house, sharp objects are padded so that if suppose by mistake they fall, they do not hurt themselves. If a patient has multiple episodes, have a tendency to have recurrent episode, see to that you floor you put a carpet over the floor so that whenever he falls down, he doesn't injure himself. See to it such patients are away from the kitchen and household works so that they don't injure themselves. They do not fall on the burning stove or a gas and burn themselves. So you need to take care of this patient this following way.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, remember, epilepsy is not that scary what it looks like. It's there's a lot of social stigma associated with it. But remember, there are multiple people suffering with these problems. There's a whole group of people. You are not alone in this problem. So take help whenever necessary. Talk to someone. Get support because that will help you make better. An epileptic patient can live a normal life. There's at all no difference between a normal person and an epileptic person. So far, his epilepsy is in control. He takes his medicine on time. He can live a normal, healthy, fruitful life. Therefore, whenever you see such patients or if you're experiencing such problems, do contact your doctor immediately.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.